Well, this is a good jumping off point to introduce my co-author on this new book, Yin Yang Yu, Dr. Rob Sinnott. Rob, come on out if you don't mind. I want to point out, as Rob walks out here, it's been a joy to work with him, and Dr. Xu, who was unable to leave China due to COVID, but will be on camera in a second. Dr. Xu is the Dean of Traditional Chinese Medicine, and literally he's the president of the university at the Beijing University of Chinese Medicine, and a real thought leader. And the reason we wrote this book, which is a charitable endeavor, all the proceeds go to Kids Foundation, True Health Sciences, which is the USANA Foundation, and they support Health Corps, which is a group that teaches teens around this country about their bodies, mentors them. But the reason we embarked on this was 2 years ago, there was supposed to be a program at the United Nations on traditional medicine. And because of COVID last year, it was canceled. And this is an effort to do what had been sought after for many years, which is to allow countries to share their traditional healing approaches. The basic concept, for example, for traditional Chinese medicine is if for 5,000 years you've been doing something, there's probably something there, if we can just understand it a little better. And a good example is treatment of malaria. You mentioned leishmaniasis, but malaria, obviously arguably the biggest killer of humans ever, is treated with artemisinin, which is a herb that has been written about for thousands of years in traditional Chinese medicine. So there are tools out there. Many of our chemotherapies come from Amazonian medicine. So Rob, you're a biochemist, you're a scientist who's been instrumental in this process as we try to bridge East and West, which is I think what this also achieves. Give us a little bit of your perspective on traditional Chinese medicine, and as you learn more from Dr. Xu and his team from the Beijing team, we've been there many times, how did that come together for this book in your mind?
Well, the Beijing team, Dr. Xu and the Beijing University of Chinese Medicine is one of the most prestigious institutions for training physicians in traditional Chinese medicine. And they do quite a bit of research. They have a lot of clinical studies capability, and that's what really attracted our attention. And the thing that they have is they have a lot of research, they've got a lot of training, but they don't have a lot of reach as far as commercializing the research and getting it out to people. So that's where we fill the gap. With a public-private partnership, USANA is able to come in and we support the research with scholarships, with funding for clinical studies, funding for preclinical work where we're developing these products. And then USANA closes the loop by taking these products that are developed and tested at the Beijing University, and our goal is to make them available to as many people as possible, not only in China, but throughout Asia and then throughout the rest of the world as well.
So many of you are probably wondering, why haven't you learned about traditional Chinese medicine before? How's it possible that you have this rich tradition that's only now being reviewed and discussed more publicly? I asked that, and I had, during the course of a very comprehensive interview, Dr. Xu acknowledged something that the Chinese government has acknowledged now, which is that Chairman Mao did not like traditional Chinese medicine. He thought it was a throwback to the colonial era. He was embarrassed by it, and he sought to stop it, if possible, because he didn't think that was going to be the future of the country. President Xi has taken a different tact, believes it's part of the heritage of the country, should be celebrated as such, and for that reason has been more supportive of these approaches being examined widely, which is what opened this portal for us. Mm-hmm. And I've had numerous discussions with business leaders who have tried to create cultural bridges. This became relatively straightforward to do once there was broad interest in allowing all humanity to benefit from the wisdom there. So I asked Dr. Xu, the president of the Beijing University of Chinese Medicine, to share just a minute or two of his thoughts. And if you can play the video, this he tried to do as succinctly as possible.
TSM was founded on ancient discovery, but it doesn't mean the methods are automatically outdated. In fact, they often hold answers to medical questions today, such as fatigue, GI troubles, depressions, many other acute conditions you may be struggling with and have yet to find the solutions. TSM always gives us exciting paths to explore major quality of life issues, such as longevity, living pain-free, and achieving holistic balance. But let's make one thing very clear from the start. That is not a story of either or all. That is the story of with. After all, that's what yin yang are all about the balance. I would like to wish the success of the Concordia Summit. I wish that every attendee to the meeting have a wonderful day in the city of New York. I wish you the best in your health, in happiness, and to your daily life. Thank you for your attention.
So this is a tradition that started with farmers in central China, and much of it is based on concepts that arose from farming. The idea of balance, of an ecosystem. Western medicine was much more based on the idea of hunting. You're targeting your disease, you're going to sniper shot it out. We even use that terminology. How do you merge old and new in Colombia? You have top-notch Western medical facilities, and you have a rich heritage that should be harvested to support. And as Dr. Xi said, is that yin-yang's that the combination.
What I like about this example and what you're showcasing in the book is when we think about Chinese traditional medicine, we're talking about medicine that has been used for thousands of years. So you cannot leave behind those concepts and that knowledge. And the same happens with indigenous communities. But the thing is, for example, traditionally, the Chinese have been able to consolidate the information and to see the evaluation of the information. We have been able to do that with the indigenous communities. And that's why we have to do that research and do it with a lot of amplitude when it comes to knowledge. You cannot be dismissive of that knowledge. The other thing that maybe is interesting to put in place is not whether they have the medicine or the herbs for the treatment. The prevention side is also very important because those traditional knowledges are very important for prevention because they dealt with diseases where there was no traditional medicine. So they had to be very tough on prevention. And that's something that I think we should learn a lot. And something that we have done in Colombia, which is very interesting with the National Health Institute in our country, is that we have a biotherium and we're producing antiophytics in Colombia. We're selling some of the antiophytics to Central America, and we have been able to do research of the antiophytics with the support also of indigenous communities. So we have some institutes in the Amazon that regularly are in contact with traditional knowledge, and we try to connect this with traditional medicine. And I think as long as there's respect and confidence, I think that also enriches our capability to prevent and to attend different diseases.
One of the challenges that we experienced talking about traditional Chinese medicine, I suspect you had this as well in Colombia, and Rob, I want you to address this. It's just hard to translate between the two ways of thinking because they're so different. And so trying to explain qi and or protective qi, which maybe Rob can speak to in a second, and how that compares to our sense of the immune system was a difficult task. It's why the books that around traditional Chinese medicine have either been so much designed for people who are already practitioners that we don't understand them in the West, or they just haven't been written, almost dismissively, maybe included in Western textbooks. The desire here was to actually write something that could explain to thought leaders on both sides what the other people are thinking. So you did actual primary research looking at protective qi.
Yes.
And I'll just give you an example. It was developed a validated quiz, by the way. This is in a manuscript that was published in a peer-reviewed journal. And so the question would be, how often did you catch a cold in the last 2 months? Which, by the way, your mother would tell you that was an important question to ask, but we don't ask it in Western medicine too often. How easily do you break a sweat? There's some people who are always sweating, some people never sweating. There were tongue criteria, because in traditional Chinese medicine, and I went there first in 1993. My father-in-law is a very respected heart surgeon, and he was brought by the Chinese government from the United States to teach bypass surgery, because no one was getting bypass surgery, because with the traditional Chinese diet, there wasn't any heart disease. So he went over there, I went with him, and I assisted and did some surgeries, and learned a lot about the herbs and the examination techniques were different. But you had to take a concept that's widely thought of in China as fundamental, because one of the most common reasons you prescribe traditional Chinese medicine is to deal with cold-like symptoms, and you had to translate that into a way that we would understand it in the West.
Mm-hmm. Yeah, so there's some concepts in Eastern medicine, such as qi and protective qi, which are nobody's ever heard of them here. When I've mentioned them to people here, they think it's some magical, qi is some sort of like a magical force or something. but it's essential in traditional Chinese medicine. And one of the first studies that we did, and this was 2 years ago before the pandemic even hit, was we set about to quantify protective qi and ways of enhancing protective qi. And for anybody who's out there that doesn't know, protective qi is this force in your body that protects your body from invasion. So it's really exactly what you're saying, Mr. President, about the prevention. We have to become more preventative approach. So the whole idea of protective qi is if you keep your protective qi strong, then you're going to stand a better chance no matter what the invading pathogen is, whether it's a bacteria, virus, fungus. We're trying to be invaded all the time, our bodies. So we were able to find things that quantified it, and really when it comes down to it, there were 8 essential questions that you can ask yourself, and you can do a very quick assessment of your own protective qi status. And that protective qi status, we've seen during the pandemic that some people suffer greatly and some people hardly suffer at all. And we believe that a lot of that goes back to protective qi. How strong is your protective qi to help you fight off and to prevent pathogens from getting in your body?
Can I add something to that? Because I'm very fascinated. I'm not a doctor, but I'm fascinated in this conversation. Before I run for the presidency, I was a lecturer at a university, and I used to teach history of civilizations. And when I was understanding what happened in China for many, many, many years, the conflict between Taoism and Confucianism was very important because it had to do a lot with the way societies behave. And for example, the idea of social distancing that is very common in the Far East is not just because it became a tradition. It was also a way that was developed to prevent diseases. You have people moving all over the country in different geographies with different risks. That also became part of using Confucianism because it's rational, but at the same time, it has to do with the internal qi on how do you protect your own spirit and you protect your own body from the contact with the rest of society.
President Duque tells me now, you could have been a co-author. You could have helped. Where were you when I needed you on those late night calls?
Well, maybe for the sequel, I'll be there.
Actually, the hope was to write, I don't care about writing more books, but to create a literature with the UN to celebrate all these traditions and in the way we're talking about them today. So we actually begin to examine them. So just to share, and by the way, the bios in the Concordia syllabus are superb, and you should read President Duque's, but you're a philosopher. I wish we had more presidents who were philosophers. A big supporter of creative arts. And he's raising 3 daughters, 2 daughters and a son, which can tax anybody. How does studying these home remedies allow you to build cultural bridges? Because we all suffer from anxiety, and if you Google into, you can do it right now, if you go on your whatever search engine you use and search why am I so, it'll auto-complete tired. You would think it would ask you, why am I so, looking for God, but instead it's why am I so tired? Because the world is tired. So these common ailments are ubiquitous. Is there an opportunity for us to link people together beyond politics?
Now that you're putting that very important frame for the conversation, something that is worrying me is that, yes, we have been dealing with the COVID pandemic, but we're not thinking on the diseases that are going to be even more challenging in the post-pandemic. And I have been identifying this in Colombia. The levels of anxiety in youngsters, adolescents, and kids, it's something that we should pay a lot of attention. Mental diseases that could derive from being at home for so much time and with so much tension outside is something that we should put a lot of attention. Now the thing is, how do we treat these? Combining not only traditional medicine, but also other methods that are needed. I saw this in Korea. I visited Korea almost a month ago, and people are getting crazy with the technology addiction in youngsters. And you increase, for example, the level of anxiety or depression, that could generate another pandemic of another magnitude. So I think dealing with that requires to be very, very open to combine the knowledge from traditional medicine, from psychology, but also from historical traditions from each specific community.
Well, first of all, in China, they've banned, as you know, gaming during weeknights, which is a heavy-handed approach, but that's how worried they are about this. You mentioned these diseases of despair. I had the Surgeon General on my show, and he said that there will be more, this is the past Surgeon General, there will be more deaths of despair from our reaction to COVID than actually from COVID itself. That's what he said the US government expected. So it becomes crisis levels. And interestingly, a lot of these traditional therapies are therapies that explain commonplace recommendations that you got from your family, from your community, things that we've ignored. I mean, don't go in the cold, things that you don't actually understand why they're so important, but they provide a foundation to that. And it's intriguing to me to see how often this wisdom helps explain that. As an example, piercing. I don't know how many of you have pierced ears or kids who have pierced this or that, but in traditional Chinese medicine, you don't pierce some parts of the body because it interferes with the energy meridia. So it might be sort of nice to know you shouldn't pierce your pinna up here, which I told my daughters not to do anyway, but because your cartilage is not that resilient there. But these are actually things we do commonplace without thinking about. Even tattoos are probably going to be better received in some parts of the body than others in traditional Chinese medicine. Is there wisdom there that we should learn? Perhaps. But to do it, we want to do it safely. So let me go back to Rob on this. I visited your facilities. They have a big facility. It's a publicly traded company based here, but they have a big facility in Beijing as well. And I see the effort that goes into quality control. One of the big issues I had with traditional Chinese medicine is it's not a very precise distribution system. They come in little colorful boxes. You don't know if it's high quality. You can't tell who made it. It doesn't feel like pharmaceuticals feels.
Right.
How do you deal with that, especially when so much of harvesting herbal medicine is about what time of the year it's harvested and how you purify it and what toxins are in there?
Yeah, so that's exactly why I feel like USANA is a great partner for getting this out there, is because over the last 30 years, we've really perfected quality control in dietary supplements. And that industry was kind of crazy back during the 70s and 80s. You didn't really know what you were getting, but we perfected the art of chromatography, DNA fingerprinting, all this stuff to make sure that what's on the label is exactly what's in there. And what you're saying is exactly true about traditional Chinese medicine. When you go and get traditional Chinese medicine these days, you go to a small mom and pop shop, they've got herbs in containers, you're not really sure what you're getting. So there is some problems with quality control, and we feel that that's one of the big things that we can help solve, is by doing DNA fingerprinting, chemical testing, all that stuff. We can make it so that it's more impactful, but then also it's more consistent in the way it performs. Because right now, Chinese medicine works for some people, doesn't work for other people. And I think a lot of that has to do with the quality of the products, which are not very good right now.
President Duque, we have globalization of the financial sector. You probably have a credit card from Colombia. You could use it here to get dollars. We have globalization of media, right? We watch the same programs now frequently. But medicine has stayed very provincial. So what are the examples that you see of how medicine can become globalized, in part by integrating some of these traditional therapies?
I have some lessons that I can take from the pandemic, because I saw that when we were starting to face this circumstance, the idea is, how do we expand ICUs? Yeah. Okay, so we expanded ICUs, we duplicated the ICUs. But then you can't expand it more because you need to have the intensivists over there.
Right.
So how do you train intensivists? Takes 3 years, 4 years, 5 years to have a good intensivist to be able to run at a ratio of 1 per 7 ICUs. Right. So telemedicine and the expertise from people out of the country sometimes can make a difference. We saw it in Colombia locally. I mean, we had some medicals in parts of the country that could be able to diagnose from another place. So we decided to move forward 2 policies: to have the medical history online. Mm-hmm. So any doctor in Colombia, obviously with permission, could look at your history and could have that diagnosed.
This is a Colombian company, or?
No, this is a policy that we stated.
No, but which system do they use? It's not easy to get medical records everywhere the same.
We started with making the database homogeneous through the healthcare system. So we had a communicated database. The second thing that was very important, I never thought this was going to be it would move so fast. We passed from 400,000 medical approaches to the patients per year. And it passed for 14 million. And today we're something around 11 million. So it makes a sense to have the medical record online, and it makes electric to make more profound the telemedicine. But something that I consider is very important, something as simple as washing your hands, which was something that started with the pandemic to people being more conscious. Reduce transmissible diseases in Colombia at the same time we were facing COVID. But then you have to be able to have specialists to deal with other transmissible and non-transmissible diseases. And that's where I think multilateralism and an integration between countries with a specialist on one thing vis-a-vis the other can also be an improvement to be constructed out of this lesson that has COVID-19 left on us. And I want Latin America to be a leader in that process.
Well, it's been a true pleasure having you on the panel. I had a luncheon just before this session where I like luncheons, I get to meet people, but it reminds me of why Concordia is so unique in that I can, and you can, meet incredible individuals who have no idea how special their accomplishments are until you sit down and talk with them. So Dr. Sinnott and I are going to sit outside in front of the green room and sign books. There are books in all your packages, your carry-away gift bags, next to the gold bullion. So meet us out there if you want to talk more about any of these topics. Rob, I think you should go to Colombia. They have so many, they've got tons of people working in Colombia. I think this is a good opportunity to...
You two are invited, and we should launch the book in Spanish as well.
We'll launch the book in Spanish. I want to write a book about Amazonian medicine and its heritage so that we can come back to the UN and do what the initial goal was. Because that's how we'll be able to change the world, by getting every continent to realize they're part of the solution as well.
So am I invited to be the next co-author of the
Yes,
book?
you're next co-author. You already wrote the introduction. God bless you. Can I invite Dan Masuga? Where's Dan Masuga? The big burly, this is my key grip. He always wanders around carrying the camera. There, come up here. Without him, we would never have done this. He was the one who first took me to Beijing to meet with Dr. Xu and had the confidence that the Chinese, if we pushed enough, would want to actually write a book that was better for all of us. Come on up, Dan. Let's get some photos. Come up here. Take your mask off.